If you're collecting Social Security, what I'm about to tell you could completely wipe out your next cost of living adjustment, and it affects over 70 million Americans. Medicare Part B premiums are projected to skyrocket by 11.6%, the largest increase we've seen in years. And this isn't just another healthcare story. This directly hits your monthly Social Security check in ways that most people don't understand until it's too late. By the end of this video, you'll know exactly how much this could cost you personally, why your COLA increase might disappear entirely, and most importantly, what you can do right now to protect yourself from this financial hit. Welcome to Financial Area, where we break down the financial news that actually matters to your wallet. If this information helps you protect your benefits, hit that like button and subscribe for more updates that could save you thousands. Let's start with the numbers that should have every Medicare beneficiary paying attention. Current Medicare Part B premiums sit at around $174.70 per month for most people. An 11.6% increase would push that monthly premium to approximately $195 per month. That might not sound devastating at first glance, but we're talking about an additional $240 per year coming directly out of your Social Security check. Now here's where this gets really concerning. This isn't just the biggest increase in recent memory. It's happening at a time when seniors are already struggling with inflation that's hitting basic necessities harder than anyone else. We haven't seen a Medicare premium spike like this since the major adjustments back in the early 2000s, and the timing couldn't be worse for people on fixed incomes. The increase is scheduled to take effect at the beginning of next year, which means if you're planning your retirement budget based on current numbers, you need to recalculate everything. This isn't a gradual phase-in, it's a sudden jump that will immediately impact your available spending money. When we talk about 70 million beneficiaries being affected, we're not just throwing around a big number. These are real people facing real financial consequences. But the impact isn't spread evenly across all income levels, and that's where this story gets even more troubling. If you're a higher income Medicare beneficiary, you're already paying more than the standard premium, and this increase hits you proportionally. But if you're someone receiving average Social Security benefits, around $1,800 per month, this premium increase represents a much larger percentage of your total income. For seniors living on $1,200 to $1,500 per month in Social Security, we're talking about losing nearly 2% of their entire monthly income to this single premium increase. The geographical impact varies too. In areas where the cost of living is already high, seniors are getting hit with a double burden. They're dealing with elevated housing and food costs, and now they're facing this Medicare premium spike on top of everything else. Rural seniors, who often have fewer healthcare options and already struggle with access, are particularly vulnerable because they have less flexibility to adjust their coverage or find alternatives. What makes this particularly cruel is that many of the people who will be hurt most by this increase are the same people who depend most heavily on Medicare. We're talking about seniors who can't afford supplemental insurance, who are already making tough choices between medications and groceries, and who have no cushion in their budget for unexpected increases. Now let's talk about why this increase is happening, because understanding the root causes helps explain why this isn't just a one-time problem. Healthcare costs have been climbing faster than general inflation for years, and Medicare Part B covers physician services, outpatient care, and medical equipment, all areas where costs have been particularly volatile. The Medicare Trust Fund has been under pressure for years, and program administrators have been trying to balance keeping premiums manageable with ensuring the program remains financially viable. Recent changes in healthcare utilization patterns, partly due to the pandemic, have created additional cost pressures that are now flowing through to premium calculations. Policy decisions at the federal level have also contributed to this situation. Decisions about which services Medicare covers, how provider payments are structured, and how costs are allocated between beneficiaries and the government all play a role in determining premium levels. Unfortunately, recent policy directions have shifted more of the cost burden toward beneficiaries, rather than addressing systemic healthcare cost issues. The frustrating part is that many Medicare beneficiaries had no warning this increase was coming. Unlike Social Security COLA announcements that get significant media attention, Medicare premium changes often fly under the radar until people see their first affected Social Security check. Here's where this connects to your Social Security benefits in a way that's going to shock a lot of people. Medicare Part B premiums are automatically deducted from your Social Security check each month. This isn't a separate bill you pay. It comes right off the top of your benefit payment before you ever see the money. So when Medicare premiums increase, your Social Security check automatically decreases by the same amount. But here's the kicker that most people don't understand. This happens regardless of any cost of living adjustment you might receive. The Medicare premium deduction gets taken out first, and you only see what's left over. Let's say you're expecting a 3% COLA increase on Social Security next year, which would add about $54 to an $1,800 monthly benefit. Sounds helpful, right? But when that $20 monthly Medicare premium increase gets deducted, your actual net gain drops to just $34 per month. In some cases, if Medicare premium increases are large enough, they can completely wipe out COLA increases. There's something called the hold harmless provision that's supposed to protect most beneficiaries from having their Social Security benefits reduced due to Medicare premium increases. But this protection has limits, and it doesn't help new beneficiaries or people who don't have their Medicare premiums deducted from Social Security. Even with hold harmless protection, you're still not getting the full value of your COLA increase. Your purchasing power isn't improving the way it should, and over time, this creates a compound problem where your fixed income buys less and less. Let me walk you through some real-world examples of how this plays out. Take someone receiving the average Social Security benefit of about $1,800 per month. After the current Medicare premium deduction, they're seeing roughly $1,725 in their actual monthly payment. With an 11.6% premium increase, their Medicare deduction jumps to about $195, leaving them with approximately $1,605 per month. Even if they get a 3% COLA increase, bringing their gross benefit to $1,854, the higher Medicare premium means their net payment only reaches $1,659. That's a $34 increase instead of the $54 they should have received. Their purchasing power barely budged while everything else got more expensive. For someone on lower Social Security benefits, say $2,200 per month, the impact is even more severe. After current Medicare premiums, they might see $1,025 monthly. With the premium increase, that drops to $1,005, and even a 3% COLA only brings them up to $1,041. We're talking about people whose entire monthly increase gets eaten up by healthcare premiums. The compound problem extends beyond just this year's increase. Healthcare costs aren't slowing down, and future Medicare premium increases are likely. Meanwhile, COLA adjustments don't always keep pace with the real inflation seniors experience, especially in healthcare and housing. This creates a situation where seniors see their actual purchasing power erode year after year. The cost of living adjustments that are supposed to help them maintain their standard of living get systematically undermined by healthcare premium increases that often outpace general inflation. Add in rising costs for supplemental insurance, prescription drugs not fully covered by Medicare, and out-of-pocket medical expenses, and you've got a perfect storm that's devastating fixed-income seniors' financial stability. But here's what nobody's talking about in the mainstream coverage of this story. There are things you can do right now to minimize this financial damage. Most Medicare beneficiaries never review their coverage options, and that's costing them hundreds or even thousands of dollars per year. Medicare Advantage plans, Medicare supplement insurance, and prescription drug coverage all have different options with different costs. Many people are paying for coverage they don't need or missing out on benefits that could save them money. The problem is, figuring out what's optimal for your specific situation is incredibly complicated. This is where Saint people make expensive mistakes. They stick with their original Medicare choices year after year without realizing that better, cheaper options might be available. Or they try to navigate the system on their own and end up with coverage that doesn't meet their needs or costs more than necessary. The annual enrollment period gives you a chance to make changes, but most people don't take advantage of it because they're overwhelmed by the options or don't realize how much money they might save. Here's something that could save you significant money, and it doesn't cost you anything to find out. There's a service called Chapter Medicare that provides free, personalized reviews of your Medicare coverage. They look at your specific healthcare needs, your current coverage, and all the available options in your area to find combinations that could lower your costs while maintaining or improving your benefits. The people I've talked to who have used this service are saving an average of $12,200 per year on their Medicare costs. That's enough to completely offset this premium increase, and then some. Some people have saved even more by finding plans that better match their actual healthcare usage patterns. What makes this particularly valuable is that Chapter Medicare's advisors understand how all the different Medicare pieces fit together. They can show you how changes in one area of your coverage might affect costs in another area, something that's nearly impossible to figure out on your own. The consultation is completely free, and there's no obligation to make any changes. you can get a clear picture of your options and make an informed decision about whether switching makes sense for your situation. Given that we're heading into the annual enrollment period, this is perfect timing to explore what's available. I've seen testimonials from people who discovered they were paying for duplicate coverage, or who found Medicare Advantage plans that included benefits they were paying for separately. Others found that they could get better prescription drug coverage for less money, or that their healthcare needs had changed enough to justify switching to a different type of plan entirely. Beyond the immediate Medicare review opportunity, there are other steps you can take to protect yourself from this premium increase and future healthcare cost spikes. Start by building this increase into your budget planning now, rather than being surprised when your Social Security check is smaller than expected. Look into state and federal assistance programs that might help with Medicare costs. Many states have programs that help pay Medicare premiums for people who qualify based on income and assets, but these programs are underutilized because people don't know they exist. Consider adjusting your healthcare spending strategy. If you know a premium increase is coming, it might make sense to schedule certain medical procedures or appointments before the increase takes effect, or to stock up on prescription medications if your plan allows it. For long-term planning, recognize that healthcare costs are likely to keep rising faster than general inflation. This means building healthcare cost increases into your retirement planning, and potentially considering how you'll handle these costs as you age and your healthcare needs increase. The bottom line is this: a 11.6% Medicare premium increase is coming, and it's going to hit 70 million Americans right in their Social Security checks. For many seniors, this increase will completely wipe out any cost of living adjustment they receive, leaving them worse off than before, despite what's supposed to be a benefit increase. But you don't have to just accept this financial hit. By taking advantage of free Medicare reviews, exploring all your coverage options, and planning ahead for these cost increases, you can minimize the damage and potentially come out ahead. The most important thing you can do right now is get that free Medicare review to see if you're paying more than you need to. With the annual enrollment period approaching, this is your chance to make changes that could save you hundreds or thousands of dollars per year. If this information helps you protect your benefits, make sure you share it with other seniors who need to know what's coming. Hit that like button to help this information reach more people, and subscribe to Financial Area for more updates that could save you money. The more people who understand what's happening and know their options, the better prepared we all are for these financial challenges.